Can you
Okay.
explain why the 120 to 140 is so different? Because that's everyone's goal is to get to 120. So what's happening with your blood vessels between 120 and 140 that's really going to make your longevity matter?
Okay, so thank you. That's a beautiful question because what we're looking at with blood pressure is perfusion. Perfusion means that how does the blood get to the tissues in your body? How do you get that blood into your fingertips so that your nerves work and you can feel things and you have, how does it get into your muscles? And that's all through capillaries. Capillaries are so tiny you need a microscope to see them. They're so tiny that even the red blood cells themselves, which you have to have a microscope to see, have to bend to fit through.
Hello, everyone. Welcome to the Healthy Heart webinar. That's right, folks. Dr. Saunders is back in the house. If you were with us last week, he was traveling. He was traveling and wasn't able to hop on. So we're so glad that he's back because, you know, Cheryl and I had to answer all your medical questions, and we hope you all survived. We're kidding. We definitely did not give medical advice. We knew better than to do that. But it was still a really good webinar. We got to go through a lot of stuff. Cheryl and I have actually been around for a long time, so we could answer quite a few questions. We couldn't answer the medical stuff, of course, so we are so glad the doctor's in the house. We're also really excited because, guys, if a lot of you are probably joining for the first time, and
that's interesting. You know, the doctor's in the house. On the way back, you know, we're on a big 787 and there's like 600 people on board, and I hear this overhead. They say, "Is there a doctor in the house?" And I'm like, "Yeah." So I push the button and they say, "Come up to the front." And there was a guy who couldn't breathe, was having trouble breathing. I was having chest pain, and I just happened to have a pulse oximeter and an otoscope and a stethoscope, and so looked at it, and I could tell that his oxygen was perfectly fine, so he didn't have pneumonia or anything, and he had atrial fibrillation. He had an irregular rhythm, and so I could listen to his heart. And so I told him what the problem was, and he'd had that before, so it wasn't anything new. And so we were able to avert a disaster.
oh, wow,
having to land early.
wow. So what did you do?
Well, I just measured his oxygen level, and so I could tell that he wasn't having a heart attack. He didn't have pneumonia. And there wasn't any emergency. He was in atrial fibrillation. So that
probably helped him to calm down, just to know what was going on too.
Right. That it wasn't an emergency. That he wasn't dying.
Okay. Wow.
Yeah.
I hope you're on all my flights. Really,
you know what? For all the flying I've done, it's only happened like 3 times that I can remember. Yeah.
Interesting. Wow, that's crazy. I mean, you just don't really ever get a day off, do you?
No. You know what? I love what I do. So for me, every day off.
Yeah, I do know that. And we're so thankful for that. It's so funny. I just got to tell you guys, we were doing a webinar yesterday, and it was like time for Dr. Saunders to go. He needed to go be with his other patients. You know what he was doing? He was still reading over somebody's lab results that they posted on the webinar. He couldn't stop reading through it, checking to make sure everything was right, even though he had already gone through it once. He reread it, read the second part of it. It was just, this is who he is, guys. This is his world. He loves it. Yeah. And we're just so thankful for him. So you guys are, you're in the right place at the right time, because this webinar is phenomenal and we get to learn so much from him. So what we're doing today is we are digging into more of how to keep our heart healthy. Maybe you found out that your heart is not healthy and you want to know what to do. And so that's why we're here. We're gonna talk about that. And actually today's focus is on a healthy heart myth. And that myth is blood pressure. So we're going to talk about how blood pressure relates to a healthy heart, what we are often told, and what is the truth. So before we begin, Dr. Saunders is not your doctor, so please consult with your medical professional before you implement any of these changes that we may recommend.
And we don't recommend you going off your medication. without your doctor's consent. as well.
Yes.
Exactly.
Okay, with that, let's go ahead and dig in, Dr. Saunders. First of all, let's talk about blood pressure. What do we need to know about it? We hear about high blood pressure all the time. What does that really mean?
So this is really interesting. If you look at, like, for example, this is really cool. In the United Kingdom, they did the United Kingdom Artificial Intelligence Study on Cardiovascular Risks. So they entered 427,000 people into a computer system, an AI neural network, and to look at what were the risks of heart disease. And so the neural network looked at everything, looked at their demographics and where they lived and what their ethnicity was and what they were eating, and everything that the NHS, National Health Service in England, puts into their chart. Everything was put in the computer and analyzed by this neural network. And so the cool thing about this is it's not a person analyzing it. So when people do things, they filter out and they go, well, that couldn't be, so they leave that out. And so you get what that person believes. The beliefs of that person is what you're seeing. Whereas a computer has no beliefs. They don't care. They don't care what the data is. They just put the data down and nothing else. So here's what the data shows. The top 10 were atrial fibrillation. This is the highest risk for dying from a heart attack. Ethnicity from Southeast Asia. And remember, this is in the United Kingdom, so this is people who are immigrants. Oral corticosteroid treatment, age. So age did factor in as you get older. There was a risk there. Serious mental illness. Mental illness was a higher risk than all of the things that you think are really high risks for heart disease. Mental illness, low socioeconomic status, and that has to do with lifestyle, and chronic kidney disease, which is we're going to talk about at some point directly related to heart disease. And if you understand like type 2 diabetes, what do you see? Kidney disease, heart disease, right? They go together. Smoking came up on the top 10, and then gender. If you're male, you're more likely to get heart disease, and those are significant. So those are the most significant ones. Guess what? Smoking is there, but it's like number 9. It's really not as big as socioeconomic status and lifestyle. It's not as big as ethnicity or oral corticosteroid treatment, inflammatory conditions. Isn't that interesting? Smoking. Blood pressure was not even significantly associated with heart disease, with death from heart disease, not significantly associated. On the computer, see, the analysis of the computer is the computer doesn't care what the heck you believe. It just says data. Here's the data. Boom. High blood pressure, not related to heart disease. Cholesterol also, by the way, was also unrelated to heart disease. So why is that important? Why is that important to know? Because we're told a lot that blood pressure is really important. It's the silent killer, and you're going to die if you have high blood pressure. I have so many people come in having panic attacks because their blood pressure went up over 130, and their cardiologist said it's got to be down below 130 or you're going to die. Guess what the panic attacks do? They raise the blood pressure, they raise the cortisol. And guess what one of the bigger risk factors is cortisol or stress, right? Or oral corticosteroid treatments. So the significance of blood pressure is not what you think it is. In fact, it's a lot better. If you look at the graphs and you look at mortality, all-cause mortality versus the blood pressure, your optimum blood pressure is between 140 and 150. That's somewhere in the 140s. and between 7 and the diastolic, the lower number, between 70 and 80. So somewhere in the 70s and somewhere in the 140s. That's where, if you look at all-cause mortality versus the blood pressure, that's what you see. That's the reality of what blood pressure is for mortality. And so they were looking at death from heart disease. But even death from heart disease is not significant. So the studies that are done are skewed in the ways that the people doing the studies and people paying for the studies want them to be. So you get what you pay for. And that's why research in biochemical research, biomedical research is so skewed to the side of what researchers are looking for. This is what we want to show. So, and that generally comes from the marketing department of drug companies. And so when they look at like the preliminary studies, when they're just saying, well, what does this look like before they actually design the study, they'll do a preliminary study to see how they can design the study to show, to look for what they're looking for. The preliminary studies show really interesting things, like when they do blood pressure studies, they show that if somebody takes a blood pressure medication to keep their blood pressure normal, this is like 120/80, for 20 years, they have a 12% lower risk of a non-fatal heart attack, but no lower risk of a fatal heart attack. It's the same. It doesn't change at all. So when the doctor says, we want to lower your risk of a heart attack, you have to know what they're talking about. They're only lowering your risk of a non-fatal heart attack. That's all. Your risk of heart attack does not change a bit from the blood pressure medication. In fact, other things might actually make it worse, because that graph of mortality to blood pressure shows that as you lower the blood pressure, you actually get worse. You actually die faster from lower blood pressure than you do from like the 140s over 70s is kind of an optimum blood pressure. If your systolic blood pressure is between 140 and 150, you have a lower than average death rate. So at 140, you have, or 120, 130, you have an average death rate. As you go below 120, your death rate goes up dramatically fast. And it isn't until you get up over 150 or 160 that the death rate starts going up a little bit. And so it's entirely different than what we were told, the silent killer, high blood pressure. Isn't that interesting?
I thought this was really interesting too. So our friend Butch, he's been on our diabetes webinars before, and just such a fun guy. I got to chat with him, but he said he just had his 6-month-old person appointment. Now, I'm not sure what that is. I don't know what a 6-month. Well, I know what a 6-month-old appointment is, but not what a 6-month-old person appointment is. It says he took himself off of his blood pressure meds after using the Healthy Heart, and his blood pressure this morning was 130/70, which sounds exactly like what you were just chatting about. Perfect numbers. Perfect
numbers.
Great job, Butch. You've kind of mastered the diabetes solution kit, and now you're mastering the Healthy Heart kit. What's next? What do you want to try next, Butch? You sound like you're getting pretty healthy. That makes me happy.
Can you explain why the 120 to 140 is so different? Because that's everyone's goal, is to get to 120. So what's happening with your blood vessels between 120 and 140 that's really going to make your longevity matter?
Yeah. Okay, so thank you. That's a beautiful question, because what we're looking at with blood pressure is perfusion. Perfusion means that how does the blood get to the tissues in your body? How do you get that blood into your fingertips so that your nerves work and you can feel things, and you have, how does it get into your muscles? And that's all through capillaries. Capillaries are so tiny, you need a microscope to see them. They're so tiny that even the red blood cells themselves, which you have to have a microscope to see, have to bend to fit through. They don't just go through like easily. So all of that pressure has to push that thick blood through these very tiny blood vessels. And you can understand that if you have ever had now I've obviously never done this, but you probably have a straw with a big thick shake from McDonald's, and you try and suck that through the straw. And then you go get a boba and you get that straw that's this big around, and you go, and they suck right up really easily. The tiny straw is going to get that thick. It's just really hard. You have to have a lot of pressure to get it through. As you drop your pressure, your perfusion decreases, lowers down. You get less oxygen to your tissues. And that's especially important in your brain. So I'll give you an example of blood pressure. People are freaking out about their blood pressure going high. I'm going to have a stroke. And the reason is because of an association. Now, here's the association. Somebody goes into the ER, emergency department, and they're having a stroke. That, their one side is completely leg, and they can only move one side. The other side doesn't work at all. And so the doctor says, you are having a stroke. Okay, so then they measure the blood pressure, and it's like 210 over 150. And they're like, oh my gosh, no wonder you're having a stroke. So what they used to do is they used to give something called sublingual nifedipine, and that is a blood pressure medication that they would break the pill open and put it under their tongue to absorb it rapidly and drop the blood pressure quickly. You know what happened? People died, and they died fast, and they died a lot. And they said they died from the stroke, and it took them like 20 years to figure out that they were dying from the nifedipine that they were putting under their tongue. Well, why did they die so fast? It was because the brain doesn't have enough oxygen. So when the brain doesn't have enough oxygen, it says, raise the blood pressure automatically. That's what always happens. If your brain is lacking oxygen, your blood pressure will go up because the brain is saying, I need more. Right? It makes sense, right?
Yeah.
So then what happened is the brain is saying, I need more, and is raising the blood pressure to get more perfusion in that area that has the clogging. And then what happens is you drop the blood pressure. What happens? The brain stops getting oxygen. Boom, done. It's over, because now you don't have any perfusion because you've dropped the blood pressure, and the brain can't keep up the circulation in the brain. And so it took them many years to figure that out. Now you go to the ER, they don't give sublingual nifedipine anymore because they don't want you to die from the stroke. They give you something else instead. They give you clot busters. They give you enzymes they inject into you that break up clots and then allow the blood to flow into the brain, right? Doesn't that make a lot more sense? So the idea that the high blood pressure caused the stroke was because people with strokes are going in with high blood pressure. They go, aha, see the association, but they got it backwards. The causation was the brain lack of perfusion was causing the blood pressure to go up, not the other way around. So all of these people who are running around saying, oh, my blood pressure is high, I'm going to have a stroke. There's no evidence for that at all. That's not even real. It's not even a thing.
Wow, this is so
interesting. Does that answer your question, Cheryl?
Yeah, it does. I just am like, my husband's on blood pressure medication because I don't know what his blood pressure medication is, but does he need to get off of it now? Or I was just at the doctor and my blood pressure was 99 over 78. So that's almost too low then. That's
a little too low. Yeah. Yeah. And it's not unusual for women to have a lower blood pressure. So the study that I was quoting that had the 140 over 70 was in people who were over 60. So that was wouldn't be typical of like young women who are menstruating, have hormone fluctuations, and progesterone dilates blood vessels and causes the blood pressure to be lower. So certain times of the month, you're going to have lower blood pressure than others. And so there's a lot of other factors that are entered in. The point is that there is not in the AI system, in any study that's been done, there's not a real association of high blood pressure with either stroke or heart. There's association, but not causation. Yeah.
Wow, very interesting. I don't know why, but your connection's cutting out a little bit, Dr. Saunders.
Sorry.
I don't know if there's anything you can do, but I'm just gonna let you know. There was something that came through the chat here that I thought was interesting. Roy said, my blood pressure this morning is 140/71. Wow. And I thought I was in trouble with my doctor. Maybe not.
No, I hope not. That is perfect. So that's a perfect blood pressure.
Awesome. This is good to know. All right. Allison says, I've been diagnosed with aortic stenosis, severe or leaky valve, and I have no symptoms, but they are telling me I need a valve replacement. And I had a stress test and my blood pressure didn't go up. So they stopped it early and I still had no symptoms. I'm on blood pressure meds. Can this be helped with diet and supplements? Thank you. Oh, it's actually Bob who's asking.
Bob, okay. So, gosh, the blood pressure didn't go up with the stroke. On blood pressure medications,
With a stress test, it didn't go up.
Yeah, that didn't go up. So what can what be helped with diet?
I think the aortic stenosis or
The
leaky
aortic
valve.
stenosis, yeah.
Leaky valve.
No, I don't think so. Aortic stenosis is something that the aortic valve is actually narrowed and doesn't open all the way because it's constricted for some reason. And usually there's calcium deposits around it. No, that's an anatomical thing, and I don't think diet is going to be of a lot of benefit for that.
She says it's or leaky valve. Is that the same thing? Aortic stenosis is a leaky valve?
No, you can have both. So the leaky valve means it doesn't close all the way. Or with the pressure of the heart, it leaks back into the heart from the aorta. When the valve is supposed to be closed, it's leaking back into the heart. So then that makes it, of course, very inefficient to pump and then leak back and then pump and then leak back, pump, leak back. So that's a problem if it's leaky. And that's another problem if it's stenotic and narrow. It's just like that straw. You can't get all the blood through it. If you have a wide valve, then the blood flows really easily. If you have a narrowed valve, then it's really hard to get the pressure up so that you can get perfusion to your tissues.
Very interesting. I was kind of laughing thinking about the whole boba thing through the straw. I'm like, well, you can still choke on that too. Because I think I tried to do that, and sometimes the boba's too big and all of a sudden you're choking because it comes when you're not thinking about it. But anyway. Okay. This is good though. This is such good information. Connie says, can a mega dose of progesterone work to stop your period? Okay, hold on. Let me reread this. I'm adding words that aren't there. Can a mega dose of progesterone to stop your periods cause a heart attack?
Not likely. It can cause a drop in blood pressure because progesterone is a relaxant. It causes your liver to make something called allopregnanolone, which relaxes and especially smooth muscle. And so like the uterus, as the baby's growing, the progesterone goes up really high. And what progesterone does is allows the uterus to relax and relax and relax. And when you're ready to deliver a baby, the progesterone drops, and then you start getting contractions and to be able to deliver a baby. So that relaxant effect of the progesterone causes dilation of blood vessels, and that's why blood pressure can drop. And so as far as causing a heart attack, that wouldn't be a likely thing, but dropping blood pressure, yeah. So you might get dizzy or feel fatigued, that kind of thing.
All right, let's chat a little bit about how the Healthy Heart Solution Kit, or even we have two. We have the high blood pressure solution kit, which is something we haven't talked about a whole lot on our webinars. we also have the Healthy Heart Solution Kit. And this one's actually this is our newest solution kit. Do you think both of these equally could really impact blood pressure?
So our first question is, do we need to impact blood pressure?
Yeah, true.
And because if we look at the blood pressure and look at what do we need to know about the blood pressure? Well, if it's high, then we need to know why. Why is it high? If it's too low, we need to know why. Why is it too low? Because there is an optimum. You know, when you look at, I'll show you my phone here. When you look at the optimum blood pressure, it's not allowing me to see it. Gosh, that's too small. There's an optimum. If you get too low, your death rate goes up. If you get too high, your death rate goes up. You want to be right in the middle area right there. And that's this is from the Lancet. It's a large study from the Lancet. That's 130. That lowest point there is 130. This one is the diastolic.
Oh, we lost you there for a minute.
And the diastolic is between 70 and 80. Same thing as the other studies have shown. So you can see on the graph that as your blood pressure drops down, your death rate goes up. So you need to know both. If it's not around, a normal blood pressure 130 over 80-ish, then you need to know why. So if blood pressure is high, then why is it high? One of the things that can cause it to be high is insulin. So when people have a type 2 diabetes, for example, they often have high blood pressure because they're insulin resistant. But the insulin is only a marker. It's not the cause of it. The cause of it is the brain is not getting enough sugar. The brain is starving for sugar amongst all this glucose. So what does the brain do when it's starving for sugar or oxygen or energy? It goes, raise the blood pressure. So it causes constriction of blood vessels to raise the blood pressure to get more perfusion in the brain so that it can get more sugar. So that's where the issue comes in with diabetes. So knowing that, then, if you can lower the insulin resistance, your blood pressure will naturally drop down when your brain says, we got enough sugar here.
All right. John says, I just took my blood pressure. It was 121 over 65. My doctor said the new blood pressure standard is 120 over 80. This info came out in the last 30 to 60 days.
Yeah. If you look at who did that, who makes the standard, it's drug company marketing departments. That's who makes the standard. So whatever you hear about blood pressure is marketing, and you know what marketing means.
I just am blown away that the definition of healthy is changing. That what we're fed as healthy is from the doctors and the medical establishment is not necessarily what's best for us. That's blowing my mind. That people are being put on blood pressure meds when they don't need to be.
Oh, that's interesting. Yeah, I was going to ask you, what do you mean by that as the definition? In what way? What's been defined?
They're saying 140 is good. Well, people who go to the doctors with 140, the doctors are telling them, no, this is too high. Let's put you on blood pressure meds. What's actually a good spot. And 120 over 80 has been around, I feel like, for a long time. Yeah. But actually healthy is 140. And either doctors are saying that's too high, or and then go on meds. So it's just what we're being told is not what's best for us. By that. And
that's the problem with marketing, and when we're getting all our information from a corporate marketing department, then you're going to get whatever they're selling. You just get what they're selling, and so they can sell a lot more blood pressure medications if they make it 120 over 80 as opposed to 140 over 80.
All right. Okay, Ernest says, is the clonidine patch, or does the clonidine patch help the blood pressure, or does it affect the heart in a negative way? One doctor had me on it while another one took me off.
Yeah, the clonidine patch is it dilates blood vessels. That's what it does. And so in some sense, as lowering the blood pressure, it can decrease perfusion. And so that's where other doctors will take you off it, because you're not getting enough blood flow, because you don't have enough pressure to get the flow through those little tiny capillaries and through your system. So yeah, that's I agree. I generally don't use clonidine at all, because it tends to dilate blood vessels and cause people to get dizziness and fainting spells and things like that. So I try to avoid that.
Okay. Alicia says, I have perfect cholesterol levels, but my doctor wants me to start statins as a preventative against heart disease. I'm not keen to doing this. I am 55. My blood pressure is good, although I am a type 1 diabetic. What's up with that? Why would a doctor want that?
Well, that's what Cheryl was just talking about, redefining healthy as instead of what's actually healthy is what makes our bottom line healthier. So the cholesterol, LDL cholesterol, is not associated with heart disease. Statins have never been proven to decrease the rate or amount of heart disease. And yet I've had cardiologists tell me that they should put statins in the water, like everybody should be taking it, because it's so good for lowering cholesterol. But what happens when you lower cholesterol? Well, you die faster, actually, and that's been proven in multiple studies. The largest study ever done is 12.8 million adults that they've shown this graph of cholesterol, and you can see your chances of dying. This is the death rate. That's just double the death rate right here, 2.0. If your cholesterol is 120, you have twice the death rate of somebody who's 220. So you'd rather your cholesterol be 240, 250, somewhere in there, where you have the lowest death rate, than if it's elevated. So the research is entirely opposed to what the doctors are telling us. And that's what Cheryl was just talking about, redefining what healthy is.
Our friend William is on. He said his blood pressure is 115/72. I'm over 60 and I want to make sure I get oxygen to the whole body. What do I do to get into a better level?
Oh, great. That's really good. Okay. So make sure you get enough salt. Do you know that salt restricted diets are associated with a higher cardiovascular mortality? Now, I did not say causation, I said association. But if you don't get enough blood pressure, if you don't have enough blood volume, that salt restriction is not healthy at all. You actually need the proper blood volume for your kidneys to function right, for your heart to function right, for everything to get the proper perfusion. You need that blood volume. And so the way you manage the blood volume, your kidneys are really good at doing this. You don't have to try and figure out every little bit of everything you eat. How much cholesterol do I have to eat today? How much salt do I have to take today? You know what? Just take in enough salt. But salt is sodium, and then the other half is potassium. So making sure you get enough sodium to keep your blood volume up, and then making sure you have enough potassium to keep your cellular fluid up. So inside your cells has water in it, right? And in order to maintain that water, you have to have potassium. It's the potassium that does that. So how do you get enough potassium? Most Americans are deficient in potassium because we don't eat all the foods that contain potassium. You're not going to get it from meat. You're not going to get it from fried foods. You get it from fruit, vegetables, beans, potassium, like baked potatoes. So I guess French fries have potassium, right? So a baked potato is like 900 milligrams of potassium, but you need 4,000 milligrams a day to just maintain your cellular volume. So sodium, potassium, and the other one that's commonly deficient is magnesium. So keeping these electrolytes up will keep your blood pressure correct, good, so that you get good perfusion. And that's really important because your tissues in your body are not monitoring perfusion until you start getting pain, like people with fibromyalgia. They have low perfusion and they get pain because of this really low perfusion. But this moderately low perfusion where you're just a little hypoxic, they're not going to scream and yell like your brain. Your brain will scream and yell.
My daughter and I went to, I think it was a Subway last week, and one of the workers was helping us and his eye kept twitching and he couldn't figure out why. Is that a lack of potassium, or what is that an indication of?
Usually magnesium, a lack of magnesium.
Okay.
Yeah, it's very common to get these little muscle twitches with lack of magnesium. You can feel them anywhere, but they're really noticeable in the eye.
Yeah. He was a young kid. He couldn't figure it out. And I'm like, it's a lack of something. I just couldn't remember for sure what it was. So it's funny how our body will give us indications of what we need if we can pay attention to our body. It's pretty cool.
Yeah.
And nowadays you can buy different kinds of salt. There's Himalayan salt, there's real salt. I think one of the new things is Redmond's real salt, which I think is actually mined in Utah. So you might know about it, but why would you choose those over table salt?
Yeah.
They have other things in them. So for example, the one from the Great Salt Lake, that salt is the real salt, has some magnesium in it. It has some other trace minerals in it. But it's still essentially just salt, a sea salt. People think they're getting things like iodine, but iodine is not found in any salt unless it says iodized salt, iodine added. If it's not added in it, so people think, oh, I eat sea salt, so it has iodine. No, not the case. But there are other trace minerals. The Himalayan salt has some. The reason it's pink, the pink in the salt, is from iron. So these other kinds of trace minerals that are in there are somewhat helpful. So, for example, in Israel, a lot of their water comes from reverse osmosis water, and so the filter that they force the water through takes out minerals, all the minerals. It takes out the sodium and chloride, right? But it also takes out magnesium and iodine and every other mineral. So they've actually found in Israel low magnesium is a common deficiency. Magnesium deficiency is a common problem since they've used this RO water, reverse osmosis water. So, even though it's small amounts, when you think about it, you're drinking it and you're kind of consistently taking it in, it adds up.
Yeah. One of these days, I just had a thought. We should talk about water again and the importance of it, all the different kinds, all the different filters. I have a Berkey filter actually right now. Sometimes I'm like, well, anyway, that might be a fun discussion. I think we have done a webinar on water and hydration in general, and that would be important. I got to write that down. We got a list, guys. We have so many webinars planned for you guys. You have no idea. I think we're good for the summer already in what we have planned, but sometimes we get really excited and we just change the whole plan. So that's just how it is. Okay. Next question. Our friend Gary's on. Heart episodes such as tachycardia, etc., can be relieved by putting hot sauce, Tabasco, in your mouth. Please talk about cayenne pepper and capsaicin for heart issues. Any thoughts?
Okay. Yeah. Actually, capsaicin is something which includes red pepper, putting the hot pepper on your tongue. The way it works is to deplete what's called substance P. It's the pain, and so it burns when it's on your tongue, but it goes through your system and depletes substance P. And decreases inflammation. It's used for a lot of things. It's used for people that have neuropathy from shingles, for example, various other ways, reasons for depleting substance P. But as far as fixing heart disease, it might have a temporary effect of dilating blood vessels and allowing lower blood pressure temporarily, but it's not a long-term solution.
Interesting. I do like hot sauce. I wish I could have, I like Tabasco, but I wish it wasn't so hot. So if we could make just, a not hot Tabasco, I feel like that'd be really good.
Well, they do. Right. I think the green stuff is not hot.
It is it's still a little bit, I think, but
yeah, it is a little.
I like the flavor of it. I remember in college, we even put it on popcorn. That was so good.
Huh.
All right. Doyle says beats per minute at resting. Mine is 54, but I didn't hear that mentioned. What do you think about that? What should our resting heart rate beats per minute be?
Yeah, we didn't talk about heart rate at all. Okay, so heart rate is highly variable. If you get someone who's a marathon runner, then they're in the 40s. I even had a couple of them in the 30s. And you're listening to somebody's heart, and it goes boom, 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 boom. And you're like, okay, keep going, go on. Speed up a little bit. It even sounds worrisome. But anywhere between 50 and 80 is kind of in the normal range, but that's going to be variable too. It's going to go up and down. People who wear those Aura rings or those Fitbit, the watches, they often come in and they show me their heart rate, their continual monitor of their heart rate and how, oh, look, it's gone up over 100 here. Well, what were you doing? Well, I was walking, and so when you're doing stuff, your heart rate's going to go up because you need more blood flow because of using the muscles. And then when you're doing nothing at all and relaxing, then it's going to come down. And so generally, when you're doing your blood pressure, you're going to be in a relaxed state. So you expect it to be somewhere between 50 and in the 50s to the 80s, somewhere in there. Over 100 is considered high unless you're currently exercising. So then you have to ask the question, why? Why is it high and I'm not exercising? Because there should be a reason for that. And people who were low, there are some people who were low who get dizziness because they're so low and they stand up and they're going, whoa, because they're not getting enough perfusion up to their brain because their heart just isn't beating fast enough to get the blood up there.
There was a message here from Rita, and she had said, does an aspirin make it go away? Let's talk. I don't know specifically what she's talking about, but let's talk about the role of aspirin. We hear about that a lot in relation to heart or heart attack. What's that all about?
So aspirin is something that stops platelets from sticking, and clots are formed from platelets sticking. And heart disease, we've talked about before, is from clots. And so if you have blood clots in your arteries, then that's heart disease, that's vascular disease. And if it's in your heart, the blood vessels of your heart, that's heart disease. So what the aspirin does is it stops platelets from sticking so you don't form clots as easily. It's not that you never form clots, it's that you're not going to get the platelets causing the clots to form. So that's where aspirin therapy can be helpful by stopping the clots from forming. However, when the long-term research is done on normal people, this is people who don't have clotting problems and don't have vascular disease, as far as prevention goes, if you take aspirin, you're more likely to get bleeding because it prevents the clotting, right? So you get bleeding. It also decreases the lining of the stomach, the protection that your stomach has, so that you can end up with ulcers, and then they can bleed, and then you keep bleeding because you're taking aspirin to thin your blood, right? So you're more likely to have a problem with bleeding ulcers than you are to prevent a heart attack. So yes, it works to prevent a heart attack, but there are side effects that are worse. So that's where cardiologists will put some people on aspirin, take others off aspirin. Well, your risks are too high. Whereas somebody who has clotting problems, then they might have more benefit from the aspirin than the risks.
And that, I mean, getting back to the basics, the Healthy Heart Solution Kit is a really good option if you're looking to get your heart healthy. This is what Dr. Saunders recommends to his patients, and it's just full of a lot of good information. If that's something you want to check out, head to bartonwebinar.com. But in this, you'll find information on the research that Dr. Saunders has done, the best way to eat for a healthy heart. How does stress impact your heart? Exercise. There's some natural remedies. There's a little cookbook, great recipes in here, guys, really good recipes. And we go over the basics too. You know, what is heart disease? Who has heart health issues and who is headed that way? How to figure out if you might be in trouble. Just a lot of good information in this. And if you want this, you can get the digital version, which means it'll, you can just download it to either like your phone or your computer or something for $19.97. So very inexpensive. It would cost a lot more to go see Dr. Saunders and have him tell you, he wouldn't be able to go through all of this in one setting with you. So you'd have to have a couple of appointments.
You get what you pay for.
I don't think that's very reassuring though. But it really, really is good information, you guys. And if you want a hard copy of this, that is an option as well. It just costs a little bit more. So bartonwebinar.com is where you'll find that information. And then, you know, what we recommend is do this and then hop on our webinars each week and ask the questions as you're going through this, or chat with other people on the webinar about what's working for you or what you have questions on. You'll be surprised at how many people are able to give advice on the webinar about what's worked best for them. So be sure to check that out. That's the recommendation for our Healthy Heart Solution Kit. And then Dr. Saunders, why did we create this Healthy Heart Support? I don't even know if I can get a good view on that. There we go. What is this for really? Well, actually, before you answer that, I want to tell everyone what's in it, just so they know. L-carnitine, we have beetroot, ashwagandha, olive leaf extract, and coenzyme Q10. Why does that matter?
Isn't that interesting? It's kind of a funny combination. And there's no other supplement that has this combination. Because when we were looking at it, we were looking at, okay, what is a common issue with hearts? Well, not having enough of certain nutrients. There are certain nutrients that are deficient and commonly cause things like congestive heart failure. So we included L-carnitine, which helps the fat get into the mitochondria to be more efficient in making energy, and coenzyme Q10, which is very important for the function of the mitochondria to make energy. So these are really important common deficiencies that end up with causing or allowing people to get heart disease. And then we have these other kind of funny things like ashwagandha, things that the herbs, but their purpose is to decrease stress hormone levels. And why is that important? Well, remember the AI from England when they put 420,000 people into a computer? What were the top ones? Well, besides the atrial fibrillation, which is an indication that there's not enough energy in the heart, which is why the CoQ10 and the L-carnitine are really important for putting the energy in. So that's for number one. The rest of those are all stress-induced or related types of, not the rest, but many of those in the top 10 are stress-related. And stress prevents your blood vessels, your arteries from repairing. And when you form a clot, they don't repair quickly if you have a lot of stress. So the idea is to get the cortisol levels down so that you can repair your arteries well. And it's not the answer. It's not like like you need this supplement to fix everything. It doesn't fix anything. It's a support to help you in your other things that you're doing with the rest of the program.
Yes, that's good. Guys, if you're interested though in that supplement to help support, you can use code webinar25 and that will save you 25%. So head to bartonwebinar.com. There's a link to the supplements. Use code webinar25. You can also use that code on the Healthy Heart Solution Kit as well. So Really good question here from Connie. I seem to be plagued with palpitations, but have worn numerous heart monitors and taken stress tests with no problems. I have researched palpitations, but it really bothers me sometimes. Doctors have told me that I have the unfortunate situation of being able to feel them because a lot of people can't. What are your thoughts? Thanks.
Most of the time when you can feel them, it's because the heart is beating also harder than usual, which is related to a hormone called adrenaline or epinephrine. When your adrenal glands put out extra adrenaline, it's not necessarily that your heart is beating faster, it beats harder and you can feel it. And some people, when they have this adrenaline, they'll feel it in their neck and they'll feel, I feel like pulsating in my neck, or hear it in their ears, or like it's tinnitus. So most of the time that comes from adrenaline, and that would be something to look at and say, well, why would that be happening? Is there some adrenal problem? Is there some anxiety issue?
Yeah.
And that's part of what we were just talking about with the healthy heart. That's important to look at because that does affect how your heart functions.
Judy is asking if you could define profusion again.
Oh, okay. It's perfusion, Perfusion. Perfusion is how the blood goes through, gets into the tissues, into the through the capillaries, into the ends of the capillaries, the tissues. So perfusion is the blood getting through into the tissues.
Okay. Rita says, I wanted to know if you think if you're having a heart attack, should you take an aspirin to make the heart attack go away? That's what she was asking.
Okay. Yes. Okay. Because remember, the heart attack is probably a clot and you don't want it to get bigger. Aspirin is not going to dissolve the clot, but it may prevent it from getting bigger because it may prevent the platelets from sticking to it. So that's a possibility. But actually, there's some research to show that magnesium is even better, that magnesium doesn't have any side effects, and it dilates blood vessels and allows perfusion better. So taking magnesium, if you're having a heart attack or chest pain, is probably even better than taking an aspirin.
Interesting. Okay. I guess that would make sense. You know, magnesium's kind of the wonder, well, it depends on how you take. I was gonna say the wonder spray, because that's how I use it, but you can take it a lot of different ways. So, oh, this is good. Okay. Marion said, I just took my blood pressure and it was 117/79. Pulse is 68. Is this normal?
Yes, it could be very normal. That's not necessarily a problem at all. You have to remember that there's a lot of factors that enter into blood pressure. And the reason we were looking at blood pressure is because we're told it's the silent killer, and it's not really, that it's an indicator. And so you might ask the question, well, why is your blood pressure low in this case? And is it because you're quiet and relaxed and you don't need a lot of perfusion? Or is it because your blood vessels are dilated? Is it because you have certain hormones right now? I don't know, but yeah, it could be perfectly normal.
How much magnesium would you recommend for Rita to maybe have on hand in case something did happen?
Okay, somewhere around 500 milligrams.
Okay,
is a reasonable dose.
And
You know, it's interesting. What?
I was gonna say, last time, I think you, at least in one of the other webinars, you said it doesn't matter what kind of magnesium you have, like in
Yeah.
this situation. So yeah, 500 milligrams, not of the spray kind in the mouth, but
Yeah.
of the supplement.
Right. Yeah. So with magnesium, people say, oh, you have to get this special neuromag, or you have to get. No, really, yes, there's less absorption from magnesium oxide, but it's still okay. It still works. You still get a lot of it.
Okay. Gary says, my sister, age 61 with SLE, with AFib and low BPM. It's in the low 30s. Episodes has dueling cardiologists on whether to use metoprolol or fast-acting metoprolol to treat AFib episode. One doctor says no, and the other recommends fast-acting metoprolol. What does Dr. Saunders think?
Okay, so here we have an issue. This is called lupus, systemic lupus erythematosus, and that's what SLE is.
Okay.
And it's an autoimmune problem, an inflammatory problem. And so what we're seeing here is atrial fibrillation, which means the heart doesn't have enough energy. And that means there's not enough mitochondria. So what she needs to do is build mitochondria, but she also has to get rid of the inflammation. So taking care of the SLE, which is often done with an autoimmune diet, is I've found to be very helpful. So dealing with that, the underlying cause first, and when somebody has a heart rate of 30, and if they're in atrial fibrillation, taking metoprolol is probably not a good idea, because that will drop the heart rate and drop the blood pressure. And we know that low blood pressure is worse than high blood pressure. And I just showed you the graph on that. So dealing with the underlying cause is so much more important than taking a medication for an immediate symptom. So yeah, that's what I would do.
Okay. I love this. This is an off the wall question, Alicia says, but could you suggest a natural remedy for hay fever?
Yeah, try quercetin. Quercetin is a bioflavonoid, and it should be taken with bromelain. And you can increase the quercetin. You get like 500 milligram capsules, and you can take let's see, 2 of them a day to start, and then just increase by 1 a day until you get relief. And I've had people on like 6 grams a day where they're taking 3 of them twice. No, it would be 6 of them twice a day. Yeah, 6 grams a day. So sometimes it gets up to that, but take it with bromelain so it's well absorbed.
Okay. Final question here from Susan. When speaking about being able to clear the arteries via diet and certain supplements, does that mean cholesterol and plaque or cholesterol only?
Okay. Take cholesterol out. Remember, cholesterol is not associated with heart disease at all. It's clots. So what you're clearing out of the arteries is clots. There's no cholesterol there. The tiny amounts of cholesterol that are found in the clots are the red blood cell membranes. That's all the cholesterol that's in the plaques and arteries. So you have nothing to do with the cholesterol at all. What you really want to do is dissolve clots, and that's where we're clearing out the arteries, and that can be done with the program. That's the purpose for the program and why we wrote the Healthy Heart Solution Kit in the first place.
There you go, folks. This is what you want to do. Healthy Heart Solution Kit. You can find that at bartonwebinar.com. Use code webinar25 to save 25%. And that is all for us today. You guys come back next week. We're going to chat more about the heart and take more of your questions. So I'm excited to have you guys back. Thank you, Dr. Saunders.
You're welcome.
For being here, and we will see you next week.
All right. See you next week.
Bye, Cheryl. Thank you so much. Bye-bye.